Welcome back to this final video in this six-part series on thriving through perimenopause. I'm your host, Dr. Anna Glazer, a reproductive and integrative psychiatrist and your guide on this journey to mastering midlife. In this particular video, we're going to focus on mastering the mind, and I'll share more about what I mean in terms of mastering the mind in a minute. First, just as a brief review, in the first two videos, what we did was discuss a lot of the psychological and other symptoms of perimenopause so you can really understand how many different systems in the body it impacts. We also debunked a lot of the myths and stereotypes around perimenopause, particularly around aging, and we discussed the science behind the psychology and the hormones because understanding that science is really going to help you better decide what treatment options are right for you. In the third video, we discussed one of the gold standard treatments for the menopausal transition experience, which is hormonal therapy, menopausal hormone therapy or hormone replacement therapy, however you want to discuss that term. And then in the last couple of videos, 4 and 5, we really dove into some of the most common and most functionally impactful psychological symptoms of perimenopause, specifically mood swings, brain fog, and sleep challenges. What I'd like to focus on now, in terms of mastering the mind, is a few really important aspects. The first is the role of CBT, cognitive behavioral therapy. There are a lot of data on CBT for various perimenopausal symptoms. What is CBT? CBT is a style of psychotherapy that has been developed and researched many years, and it really focuses on the relationship between our thoughts, our feelings and emotions, and the behaviors that we execute. We often discuss the CBT triangle, which is basically a triangle that links these three aspects, our thoughts, our emotions, and our behaviors, with bidirectional arrows. CBT allows us to focus on one of those points in order to change the outcome of the others. CBT has a history of being effective for many different conditions, whether we're talking about depression, anxiety, and in this case, it also has been studied for things like vasomotor symptoms. There's a number of randomized control trials that have looked at CBT for the menopausal transition symptoms, randomized control trials being the gold standard, where we have a control group with the placebo and then the experimental group considered the highest level of evidence. And this has been studied for well over a decade with a number of different protocols in place. If you wanted to do the research for yourself, you can take a look at the Menos 1 and Menos 2 protocols or Menos at Work. All of these were developed with perimenopause and menopause symptoms in mind, with a lot of components of psychoeducation, as well as focusing on that cognitive triangle. Most of the time, the experiments and the protocols that are in place are really something that can be done in a very systematic and short amount of time. A lot of them are really just 8 weeks long, sometimes 12. So very doable. Here are the targets of CBT in perimenopause. As you recall, I just mentioned that triangle with thoughts, emotions, and behaviors. The targets are really our thoughts and our behaviors because it's really hard to control our emotional experience, but we can definitely manage our thoughts and we can certainly manage our behaviors. So some of the thoughts that can happen through the perimenopausal experience are a lot of negative thoughts and beliefs about perimenopause. We tried to debunk some of that when we were going through the first lecture when we talked about the stereotype of aging, for example, that the menopause is really just, it's all downhill, it's all aging, those kinds of negative stereotypes. There can be a lot of distress around vasomotor symptoms, and really doing the cognitive work around those symptoms can be very helpful and has been shown to be effective at actually reducing them. There's a lot of social embarrassment that can happen. If you think about experiencing, let's say, a hot flash in the middle of a meeting or at some other kind of important event, you can begin to feel embarrassed about the experience. And so focusing on that emotional experience and the thoughts around it can be really helpful. And then a lot of anxiety about sleep. As we discussed in the last video, CBTI, cognitive behavioral therapy for insomnia, is one of the most effective treatments that we have beyond any treatments that are biological in terms of sleep aids or sleep supplements. And so anxiety about sleep and targeting that anxiety and those thoughts about sleep can be supremely effective. And similarly, we can also target certain behaviors like social avoidance or low activity levels, because if we think about the cycle, let me show you an example of what I mean. This is an example of that negative cycle, where, for example, we might start with a vasomotor symptom like a hot flash with sweating and palpitations. And so that travels into this thought, oh my gosh, everyone is looking at me. I cannot deal with this. And then we keep going through the cycle. You might feel anxious, you might feel embarrassed, a loss of control. And that leads to particular behaviors like avoiding the situation or leaving the room. And that removes you from this really important part of your life. And so there's this negative cycle. And the role of CBT is to actually break that negative cycle. Beyond CBT, I want to next focus on nutritional approaches. The reason I'm talking about nutrition is because of this really important relationship between the brain and the gut, connected through this vagus nerve, but there's so many other aspects that connect the two, including the microbiome that sits inside the gut. And the microbiome inside the gut is basically a collection of millions and billions of different bacteria of different species, and many of them have really important symbiotic function. We have so much of our immune health, so much of our mental health actually resides in our guts. In fact, you may not know this, but the largest number of serotonin receptors, serotonin is that target that we often think about for various antidepressant and anti-anxiety medications. The largest number of serotonin receptors is not actually in our brain, but is in fact in our gut. The gut-brain axis, that connection between our brain and our gut, is very important, which is why nutritional approaches are so important in managing mental health symptoms, in managing immune health, and managing the perimenopausal transition. And so a couple of things that I want to mention in terms of nutritional approaches. The first is thinking about a Mediterranean or anti-inflammatory diet. And when I say diet, I don't actually mean diet with that negative connotation that we often think about in today's society. When I'm saying diet, it's just a shorter word for way of eating. So a Mediterranean or anti-inflammatory approach has a lot of really good data, particularly for mental health, but for many other conditions like inflammation and everything that inflammation is associated with, and certain other kinds of medical conditions. And so when we're talking about these perimenopausal mental health related symptoms, a Mediterranean anti-inflammatory approach can be really valuable. So what does that look like? I'm sure many of you can Google what a Mediterranean diet looks like, but the aspects that I really like to focus on, number one, are a lot of healthy fats like a lot of olive oil, a lot of lean proteins that have anti-inflammatory properties, things like your salmon, things like nuts and seeds. Those are the things that are going to have an anti-inflammatory, and they tend to be high in omega-3s and are going to be very helpful for navigating the transition through perimenopause. The MIND diet is another option, and this is basically a combination of the Mediterranean diet and the DASH diet, which is the diet for hypertension. And it has actually been studied in individuals who are at higher risk for various kind of cognitive challenges and dementia, and has been shown to reduce those cognitive issues. So again, if we're thinking about cognitive challenges in perimenopause, like brain fog, challenges with word finding, executive function, the MIND diet might be something to strongly consider. The other piece that I want to mention from a nutrition perspective during the menopausal transition is the fact that we actually often need higher amounts of protein and fiber throughout this experience. And that's in part because the changing of hormones changes our ability to actually take in those nutrients and utilize them effectively. And a lot of women are actually taking in lower amounts of protein than they need. And in general, in the United States, the amount of fiber that we ingest is substantially lower than the amount that is recommended. So really looking at your protein and fiber content in your diet can be really beneficial. A question that I often get is, what about phytoestrogens? Phytoestrogens are foods that things like soy, things that theoretically have plant-based estrogen in them. And the jury's really still out on whether that's going to make any substantial difference in your hormone levels. The good thing, though, is that there's no evidence that there's any harm. They've done some studies, some basic research where they look at phytoestrogens, and they didn't notice a substantial improvement in perimenopausal symptoms, but they also didn't notice any harms. And the studies really went out usually about 3 months or so. So if you like those kinds of foods with soy content, for example, tofu, feel free to eat it. The next thing I want to focus on is the power of community. And this is really important because social engagement is protective for so many different things as we get older. There's a lot of data on social engagement and conversely, the experience of loneliness and disconnect being associated with mental health symptoms. So social engagement is supremely important for mental health and wellness, particularly as we age, because there does tend to be a tendency to separate and isolate, and it's important to keep those connections. One of the best ways to do that I really like to encourage is around peer connections and education and conversation, particularly on this topic of perimenopause and the menopausal transition. It can be really valuable to connect with others who are going through this experience, especially because in the past, a lot of women haven't been talking about menopause. It was something that was hush, and maybe you talk about it in whispers and in the corner of the room, and you don't really talk so much about it. And finally, there's actually so much more conversation about this experience and how it affects women who are going through it. So really connect with your friends who are maybe you're in your 40s. Connect with your friends who are in their late 30s, who are in their mid 40s, who are in their 50s, who are going through this experience. Talk with them about their experience because, again, every woman's experience is going to be different given the huge variety of different symptoms. But to talk about the experience, to talk about the different symptoms, to talk about tricks and tips and ways to feel better, and to have that conversation where maybe having watched this series, you're educating your friends and family members about the benefits of menopausal hormone therapy and some of the other treatment tools that we've talked about, the importance of sleep, all of the nutritional approaches that we just discussed, CBT, and having those conversations where you're educating and they're educating and you're sharing experience can create really important and valuable connections that are essential throughout this transition process. And the last piece I want to mention in terms of community and social engagement is really having good support from your partner. And your partner can provide advocacy for you and education. So that means that maybe you share this 6-part video series with your partner so they're educated about what is this perimenopausal experience. Have they even heard the word perimenopause before? What does it even mean? And getting them on board in terms of education can also really help quite a bit with advocacy. Advocacy is important when we connect with our doctors and clinicians. Maybe some aren't familiar with all of the different treatment options or all of the debunked myths about the menopausal hormone therapy options out there. And so you want to advocate for yourself, and it can be really helpful when your partner also helps to advocate for you. And having their support through this transition is really important. The last piece that I want to talk about is the experience of this life stage. So perimenopause and the menopausal transitions, as we discussed, takes place most of the time in the 40s and 50s. That means that there's a lot of different life stages that are taking place at this time. So one of the most common things is aging parents. And that's something that can be really impactful because that might mean that you're more involved in their lives, in their day-to-day, helping them make important decisions, perhaps in terms of health or in terms of finances, in terms of their living situation. You might be helping them on a day-to-day basis, or perhaps helping them make some really big decisions. And experiencing that aging parent timeline can be really stressful because of the amount of these logistical challenges, but also emotionally challenging because it's really hard to see our parents get older and have limitations. So aging parents is an important aspect of this life stage challenge. Another experience is what's going on with your kids. They're at various different developmental stages, perhaps, We have more and more individuals who might be having children later. So maybe you're actually having children in your late 30s or 40s, which means you might have really young kids during this experience. Or if you had them a little bit earlier, going through the experience of empty nesting. And that's a psychological transition, right? Your home used to be full of people, and now it's perhaps you and your partner. And that's a challenge. And you're trying to navigate this experience of children at various developmental stages and aging parents. And we refer to that as the sandwich generation. You may have heard of that before, but the sandwich generation basically refers to the fact that you're sandwiched, literally, between the fact that you're taking care of aging parents and taking care of your children. You're right in the middle, and that's very impactful from a psychological perspective. And the reason I'm talking about these different challenges is because I really want to encourage you to reflect on your own life stage. Going back to the previous slide where we talked about social connections, really talking about these with your community is important, and perhaps also with a therapist who's going to help guide you through this experience. As a psychiatrist, I can't think of anyone who wouldn't benefit from psychotherapy, whether we're talking about kind of classic CBT or more of a dynamic and reflective type of experience where you're really focusing on these life stage challenges. Then there's professional identity and transitions. This is a time, like we discussed early on, when a lot of women are really reaching the peaks of their capacities professionally. You might now be the boss. You might be in the C-suite. You might be in various places, positions of power. And that's an interesting professional identity. Conversely, you might also be at a stage in your life where you decide, hey, I focus quite a bit on my professional career. There's some other things that I might want to focus on, or perhaps I don't feel as well as I used to when I was in my 20s, understandably. And I want to focus a little bit more on my health and wellness. I want to devote a lot more time to the work-life balance, focusing quite a bit more on the life, taking time out to spend with my parents, with my children, with my partner, traveling on my own wellness to ensure that I experience a really nice and positive health span and lifespan. And so you might be making a professional transition. So lots of different professional identity and transition experiences during this time. Then we have the body image piece. And this is something that actually ties in quite a bit to societal expectations and stereotypes. This idea of the fact that oftentimes, certainly in the Western world, there is an emphasis on a particular type of body and a particular type of aging process for women, where basically the expectation is that women don't age. They don't age, they stay young forever, and that youth is beautiful, and that's all that we're going to value in this society. And so it's really important to look at how much of that stereotype you've taken in and you believe yourself, and reflect on that and be able to make a decision. Hey, that's not a stereotype that I want to stand by, and really create that sort of internal sense of self-worth and your beliefs about your body, your relationship with your body that make you feel good, or at the very least neutral. We don't always have to be happy about everything, but feeling neutral about it as opposed to the negative self-talk that can be really detrimental to our mental health and our experience. So looking at how much of those embedded societal expectations exist, and what do we want to think about our bodies as we go through this perimenopausal transition. What is the strength that we see in our body? What are the things that our body has accomplished? And what more can it do? How can we push it to accomplish other feats of strength or vitality that are important to us as we go through the midlife transition? Finally, I want to focus on this definition of complete health. We've talked a lot about the perimenopausal transition, and as an integrative psychiatrist, this is how I view health, and I think this is a helpful representation for you to consider. Health is more than just medical health. We often think about health, oh, do I have any medical problems? Do I have high blood pressure? Am I healthy? But health is so much more than that. I think there's really important aspects of our emotional and psychological health that contributes to our overall complete health. In this particular video series, we're focusing obviously so much on hormonal health and the influence of hormones on all other aspects of our health. Financial health is actually very important, particularly during this midlife transition, as we begin to also think about how much longer do I want to work or will I need to work? What is the state of my financial health? Spiritual health and thoughts about aging and mortality can also come up during the perimenopausal transition, and spiritual health and connection can be really valuable. And then, of course, social and relational health, whether we're talking about with your partner, with your family, with your entire social network, professionally, etc. All of this contributes to the picture of complete health, and we can't just ignore one of these bubbles. They all interrelate and depend on each other for overall health and wellness. So a few key takeaways. The psychological impact of perimenopause cannot be underestimated. And we need to break stereotypes and address negative stigmas through tools like CBT and really create a supportive community to master this phase of life. Nutritional support is essential to a smoother menopausal transition because of that gut-brain connection. And really comprehensive health includes all spheres, from the psychological to the hormonal and spiritual, and is the essence of an integrative approach to well-being. Thank you for joining me for this 6-part series. I do want to share a couple of additional resources. First, for clinicians who are interested, I do have an online course called the Fellowship in Reproductive and Integrative Psychiatry, where we take this focus on complete health and we look at all of the different treatment tools for women who are going through various hormonal transitions, including perimenopause. And so the goal of this course is to learn treatment tools to help patients where conventional methods perhaps have been insufficient. It is a hybrid kind of self-paced teaching approach where you have on-demand lectures, but also some live office hours and case discussions. It's 100% virtual. There's a lot of expert faculty, including the expert faculty that we had from Video 5, Dr. Bhopal, and many others. And there's opportunities for networking and connection. You do get more than 40 CMEs, and in order to sign up, you're welcome to go to psychiatryfellowship.com. You can learn a lot more and see the full comprehensive curriculum. And if you're watching this particular video series, you can also get a discount as you sign up for that by using the special code created for you. If you are a patient and you're in the state of California, this is an important notation that you must be in the state of California to work with me and my team at Women's Wellness Psychiatry. And as I mentioned, we take this very integrative approach to your emotional and mental wellness, and we specialize across the entire reproductive lifespan, including, like we're talking about today, perimenopause. We have a lot of highly trained and specialized clinicians, both psychiatrists and psychotherapists, with flexible schedules and prompt availability. And it's a virtual option for those of you who really need to be able to find someone that might not be available in your area. And you can visit annaglazermd.com to learn more about that. Thank you for joining me for this 6-part series as we really dove into perimenopause. Feel free to ask questions, make comments, and share this content with those friends, family, colleagues, and clinicians that are going to benefit from this education. See you next time.